40 years ago, 5 hospitals formed the National Association of Public Hospitals, now America's Essential Hospitals. What they created would become the most vocal champion for hospitals united by a mission of healthcare for all. This is the story of why that matters and why our members are still at the center of what we do. Our story began with a simple need: more public support for hospitals that struggled to keep their doors open as they treated patients with little or no financial means.
People felt that Medicare and Medicaid had solved the uncompensated or injured care problem. Medicaid, by the end of the 1970s, did not cover even half of the target population that had originally been envisioned.
It is essential that you understand, as you debate health reform, that the importance of these hospitals and health systems extends to the services they provide to their entire communities and not just to the poor.
I can remember one hearing where we testified with other hospital organizations, and one member of Congress sort of stopped and said, "Wait, you are the only organization talking about the populations you serve, talking about the vulnerable populations, people with special needs." And it really struck home with me that that is really the important thing. The dollars enable you to do the important work.
What was true then remains true today. No group unites mission-driven hospitals in one voice for the safety net like America's Essential Hospitals. And no other group better understands the challenges these essential hospitals face.
When you look back 40 years ago, maybe the biggest challenge facing essential hospitals was finding that voice, or even creating that voice that spoke on their behalf. That didn't exist before 1981. It's kind of hard to believe that. There was no singular voice advocating for these hospitals. There wasn't an organization which spent its time trying to figure out solutions for those hospitals. And that was really why NAPH was created.
I recall early on in my career in the early 1990s, going into the mid-2000s, and even so now, the role that the association has played in the national healthcare landscape, specifically supporting those that were marginalized, the poor, the elderly, recent and new arrivals or immigrant communities, populations that were not represented anywhere else.
It's around, financing and adequate financing. How do we get the resources needed for our patients to be served, the largely low-income patients at safety net hospitals?
There's nothing more important than a common purpose, and especially a purpose that is beyond self or beyond organization. And that's what makes AEH so special.
And that common purpose will carry the association into its next 40 years, marked by a steadfast and growing commitment to health equity and population health.
We stand for this larger purpose. We're not just about what's in it for us as organizations, but we are advancing health equity. We are advancing equity, not just health equity for our patients, but economic justice and economic parity. So it's really about this larger purpose.
In repairing our communities is going to be tough work. Moving us towards a better future where we learn from some of the lessons that we've seen around the lack of national preparedness, moving us to a future after we've seen the gross disparities in health and healthcare laid bare for all to see, and seeing the legacy of structural racism play out in the worst possible ways.
As equity commands a national stage, America's Essential Hospitals and our members will be right where they always have been, at the center of this work, with a proud legacy of fighting for marginalized people and underserved communities. We are, and always will be, essential.